So it's a common misconception that women don't get heart disease, or if they do get it, they're not going to die from it. It's really important to remember that the leading cause of death for women in the US is heart disease. So it is not cancer, it is not breast cancer, it is not a GYN cancer, it is heart disease, and it is way ahead of any other cancer. So then it becomes important to think, what can you do as an individual to make sure that either you don't get heart disease, or if you get it, that there is somebody good and competent who is able to take care of you. Coronary artery disease comes because of risk factors. One of the most important risk factors is if you have heart disease in your family. If there's a family member who has had heart disease before the age of 55, you are at risk. So first thing you have to do, you choose your parents. Now that's usually a little hard to do. So now that you have failed at choosing your parents, let's talk about what you can do. Number one, no smoking. Smoking is one of the leading causes of heart disease, both in men and certainly in women. Number two, untreated high blood pressure. Know your blood pressure. If it is high, it needs to be treated. It is easy to do, it's an easy fix. Number three, obesity. Everybody needs to know what is their ideal body weight, and you need to strive to maintain it. Exercise is critically important because it helps keep your weight down. Number four, if you are diabetic, know it and treat it. We treat diabetes as if the person had heart disease because the two go hand in hand. And finally, but not even least of all, is the issue of cholesterol and high cholesterol. We know that it is a marker of developing coronary disease, atherosclerosis, plaque, whatever you want to call it. And we know that if left untreated, it is a major reason to develop coronary disease. There are certain food items that may be beneficial, but the most important things are going to be exercise and not smoking. And if your cholesterol hits a certain target, you really need to be on medicine, and there are good medicines that can help bring it down. And not only do they bring down their cholesterol, they save your life.